Let's travel back to the 1500s, during the Renaissance, a time when curiosity about the human body and mind began to flourish again. While many still clung to beliefs in witchcraft and evil spirits as causes of mental distress, few pioneering physicians started to argue that mental health issues were actually medical conditions. Institutions like London's infamous Bedlam Asylum became symbols of mistreatment, where patients often suffered more than they healed. However, this era also saw the first reformers bravely questioning old traditions, planting the seeds for future change. Their efforts marked the beginning of a slow but crucial shift away from supernatural explanations toward a more scientific understanding of mental health. Moving into the 1600s, new philosophical ideas began to influence how people thought about mental health. Thinkers like Descartes introduced the concept of separating the mind and body, which encouraged more scientific approaches. Despite this progress, mental illness was still widely misunderstood. Treatments were often harsh and physical, such as bloodletting, purging, and cold water immersion. Instead of receiving real help, many people were simply confined to asylums, which continued to grow in number. The focus was more on control than on care, and genuine treatment was rare. Still, the seeds of scientific thinking were being sown, setting the stage for future advancements. 1700s, known as the Enlightenment, brought a wave of rational and scientific thinking to mental health. Influential figures like Philippe Pinel in France and William Tuke in England championed the idea of moral treatment. This new approach emphasized kindness, structured routines, and respect for patients' dignity. Instead of punishment or neglect, patients were encouraged to participate in daily activities and were treated with compassion. This era marked a turning point as humane psychiatric care began to take root. The Enlightenment's focus on reason and humanity laid the groundwork for the modern mental health movement, inspiring future generations to continue improving care. By the 1800s, psychiatry was emerging as a formal medical profession. Public asylums were built with the hope of providing structured care, but many soon became overcrowded and conditions deteriorated. Despite these setbacks, important progress was made. Emil Kraepelin, a key figure of the time, advanced the scientific classification of mental disorders, helping to lay the foundation for modern diagnosis. Therapies also evolved, with occupational work, talk therapy, and early forms of hypnosis being introduced. While challenges remained, the 19th century marked a significant step forward in understanding and treating mental health, moving ever closer to the compassionate and evidence-based care we strive for today.